Welcome back, everyone. For those of you that were here last time, welcome back. For those of you that are new, welcome. I'm going to do a mini little brief on who I am. So Ali Guajardo, LCSW, practicing out of Santa Barbara County, currently working with Santa Barbara Neighborhood Clinics, providing therapy and consultation in a clinic setting, specializing in LGBT trans healthcare. For today's presentation, I want to position myself. First of all, I'll be pulling from my lived experience. I was once in foster care from the age of 12 to 18. And in that time, I definitely saw just how mental health symptoms and trauma can be criminalized. I have two brothers that are younger than I am. Growing up as, identifying as female, a lot of my behaviors for what I experienced were internal. So that was like, I was the very compliant, good kid, whereas my brothers had very external outward behavior like aggression, fighting, breaking things, vandalizing the community. And for me, as the sibling, it was very clear that they were experiencing, trauma, displacement. We grew up witnessing domestic violence and my parents were both addicts. So to me, it was like learned behavior mixed with trauma and being displaced. And as we got older, I continued to see my brothers just be criminalized for their behavior, right? You're a bad kid. Why are you breaking things? You're a bad kid, and being moved to different group homes, and therefore landing them in the juvenile justice system. So I speak today from my experiences and hoping that what we have to teach you all can help minimize those outcomes so that those who are experiencing things can instead be seen through a lens of trauma and mental health as opposed to criminalization. Of course, our hearts are all in the right places, mental health workers and helpers, for a number of reasons, which can include lack of resources, as well as maybe not having enough education on trauma or mental health symptoms. It leaves us very few options, and some of us feel like we have to resort to law enforcement or more criminalized ways of managing these things, which can often traumatize, re-traumatize LGBT youth, as well as BIPOC folks accessing care. So overall, when we take that approach, we begin pushing them away from seeking help and support in the mental health field, and we contribute to those incarceration rates. And as of right now, according to NAMI's page, 70% of mental health workers in this field in the United States are white, and a majority of those are women. So hopefully what we teach you today will help you all feel more confident in providing care to communities that maybe you don't identify with. I'll hand it over to Bella.
Thank you, Ali. So today's presentation is really largely based in my research. So I'm coming to today's presentation as a researcher. I'm a doctoral candidate at UCSB. My research, sorry for the repeat for folks that were here last week, but my research looks at the criminalization of marginalized communities. I'm specifically working on a project right now that looks at the criminalization of Latina foster girls. So this entire presentation is really going to be a deep dive into what it means to criminalize marginalized communities, what it means to criminalize mental health from the perspective of my research. And so I look at the criminalization of racialized youth, and I've become, unfortunately, intimately familiar with the ways that incarceration and policing have become catch-all solutions to all social issues, right? We have really high expectations of law enforcement, right? And we'll get into that a little bit more later. But I specifically look at the criminalization of Latina girls, and what I've found is that so often for these girls, but even more, even on a broader scale for marginalized communities, especially if they're racialized, their trauma responses and their mental health symptoms are met with discipline and criminalization. And when a racialized person is experiencing a mental health crisis, they're already seen as disruptive, out of control, and difficult because of the process of racialization. So when we couple this with mental health, we see that and how the rates of something like criminalization become even more kind of compounded, right? And so what we'll be talking about today is how we as community members, as mental health workers, can reduce the harms that we cause during an active crisis. And I want to, before we really get into it, preface it by saying that I know nobody comes into this field wanting to do harm. We're human beings, right? Part of living the human experience is sometimes causing harm and sometimes receiving harm. So this is a proactive way for us to think about how we can be the best mental health workers for the communities that we're serving. All right, folks, so let's get into it. Next slide, please.
Alrighty, so this session today is going to be understanding the criminalization of mental health. And in today's session, we're going to take a look at the ways that our current society deals with mental health as a social issue, and we'll learn about intersectionality, which can be a tool that can help us practice person-centered care, trauma-informed approaches to mental health that consider the overlapping identities and inequalities that come together to create things like racial disparities and discrimination. So overall understanding how social identities can impact mental health. But before we get into that conversation, we wanted to review the needs that you all shared last week.
Yeah, so thank you all for, next slide, please, for participating in the needs assessment. Y'all shared some really helpful things. And I think that it's important for us to review these because you're all dealing with the same things, right? 42.8% of you said that you are dealing with self-harm / suicidal ideation, the crises that are based in self-harm and suicidal ideation. 15%, 15.9% said that you're dealing with youth safety, and this included things like CSEC exploitation, fear of, or an inability to keep youth safe. 32.8% of you are dealing with crises that are based in panic attacks, and 8.5% of you are dealing with crises that are based in basic needs. And really, the types of crises that you all are dealing with are really reflective of what's happening on a national scale. According to the Trevor Project, as of 2021, 40% of LGBT, lesbian, gay, and bisexual, and 50% of transgender, non-binary people seriously considered attempting suicide. 48% of lesbian, gay, bisexual, and 60% of trans and non-binary people engaged in self-harm. And 68% of lesbian, gay, and bisexual, and 75% of trans and non-binary folks reported symptoms of anxiety. So all of the crises that you all are pointing to, it's exactly what we're seeing on a national scale. None of these things are, ultimately, the reason that I point this out, right, is to say that you're not navigating any of these things alone. This is why a learning community like this is so important, because we get to be in community with other folks who are navigating the exact same types of difficulties that we're facing in our work. So what we're hoping is that through knowledge shares, we'll be able to learn how other folks are navigating this and walk away with a more robust toolbox for dealing with this. Next slide, please.
All right, so the next question we asked you all is what would make you feel more confident in responding to crisis? 35% of you said that you need interventions. 28% roughly said we need more resources, right? And with all that's been going on, we can definitely see that there's been a lack of resources or a drop in resources across the board, not just for LGBT folks, but housing, food, some of the most basic needs, which is going to increase crisis. So that made sense. And then 36% of you said that in building your confidence would be the folks we work with and the people that we're helping, being more confident with those. So with the current spike in like LGBT legislation, racialized forms of violence, and a major decrease in community resources, it makes sense that we're going to want to have tools to kind of help us and kind of just going off some statistics here, right? And I know these are speaking to like the LGBT community, but as they experienced COVID, a lot of them, 56% shared that they were unable to express themselves, being in homes where they were invalidated, unable to see friends, and be in spaces that affirmed their gender identities. 86% said that the political climate negatively impacted their well-being. And 58% of trans and non-binary youth reported not receiving mental health services due to concerns related to LGBT competency by providers. Right, so that's kind of what you all are speaking to when you say we need the people we're working with to be more competent or kind of practice with the cultural competency lens, just as well as cultural humility. So we see then that for like LGBT communities, their experiences are impacted by sex, gender, sexual orientation, but also impacted by things like race, class, socioeconomic status, and another of overlapping identities. That means in order for us to do good work as LGBT, as those working with these communities, whether that's LGBT, BIPOC communities, any community, we want to be practicing through an intersectional lens.
So You can go ahead and go to the next slide. Thank you also to the TA Center for dropping all of the slides. So what we're focusing on today is really the help and the helpers, right? You all identified that you need more resources in order to be sure that you're not causing more harm, more help in being self-aware of your own biases, more help in being aware of the ways that you're responding, your body language, of the way that you're becoming activated, because crises can be really activating for a lot of us. And then in terms of the helpers, right? Thinking about for our colleagues, how are we going to bring in conversations that help our colleagues learn how to practice from a trauma-informed lens? So we're hoping to give you some concepts and tools to be able to really address those issues that you all named in the needs assessment. One of the ways that in Ali's practice and in my research, one of the ways that we go about doing this is through the concept of intersectionality. So what in the world is intersectionality? I'm sure you all have heard this word before. So intersectionality actually has its foundations in the work of Black and other women of color activists of the 1960s and 70s. It was coined officially in 1989, but the concept has really been at work for a really long time. And basically what it says is that all people are moving through the world with multiple identities that impact their experiences. So this concept argues that the experiences of women of color have to be understood not only through the lens of sexism, but also through the lens of racism and classism, because for women of color, racialization and sexism happen simultaneously, right? These are not things that you can remove from each other. Intersectionality argues that each individual has multiple points of privilege and oppression that impact their experiences in society. This means that we have to consider things like race, class, sexuality, gender, amongst a slew of other intersecting and overlapping identities when we are supporting people through crisis. Now, this doesn't mean that you have to be intimately familiar with how every single identity is going to be impacted in all of the ways, right? That's impossible. But what it does mean is that we go into these helping moments with the understanding that we may not know, with the understanding that the person who is in crisis may know their needs better than we do. So intersectionality is a tool, but it's also a way for us to gain insight into how we can move through this work with a more trauma-informed lens. So we're gonna watch this quick little video to illustrate what intersectionality means. So if you could go to the next slide, please.
Perspectives. Intersectionality is a term we often hear, but what does it mean? Kimberly Crenshaw, who coined the term in 1989, explains it with a metaphor.
Consider an intersection made up of many roads. The roads are the structures of race, gender identity, class, sexuality, disability. And the traffic running through those roads are the practices and policies that discriminate against people. Now, if an accident happens, it can be caused by cars traveling from any number of directions, and sometimes from all of them. So if a Black woman is harmed because she is in an intersection, her injury could result from discrimination from any or all directions.
Intersectionality in all discussions of the rights of African American women today is built on the work of previous generations who have always been a part of the fight for full equality. Sojourner Truth.
In doing the research this time around, there were so many more articles and initiatives and push by mental health workers to talk about intersectionality. So again, in that resource page, there's really some very useful tools for intersectionality that can be used.
Yeah, so take a minute to look through the resources if that is helpful to you.
Right. So if we can go to the next slide, this is going to start our breakout room. So we're going to put you all in breakout rooms, and we really want to have a good discussion. With so many of us on this call today, it can be hard to have a discussion as a group. So we're going to break out into groups. And that question is, share an example of a time you applied an intersectional lens to a client or a community member in crisis.
Don't be shy, folks. You can either unmute yourself or you can drop it in the chat. Go ahead, Sonia.
I see Sonia's raising.
Hi, I'm Sonia, pronouns she, her. I'm with API Equality LA. And sorry, you might hear my puppy barking in the background. She's still in training. But one of the things that I talked about in my group was that applying an intersectional lens has been something that our organization has been really trying to advocate for around anti-Asian violence. Part of that is because, you know, queer and trans API folks have been experiencing white supremacist and gender-based violence for years, and we're quite an invisible community. And then it was a bit jarring to all of a sudden have this national attention to anti-Asian violence when it was happening to cisgender, predominantly East Asian individuals. And I bring up East Asian because, you know, South Asian and Southeast Asian individuals in the community experience a tendency to be victim to more violent systems and oppression. And what we've noticed is that in the national discourse, when it comes to trying to mitigate anti-Asian violence or address it, it turns to these conversations around law enforcement and like hate crime legislation.
Right.
All of those things that harm queer and trans BIPOC individuals more so, and it doesn't make us feel safe to rely on policing or surveillance or incarceration. So that's something that I feel like is really important to highlight in these conversations. And when we're talking about intersectionality, is that if you are a cisgender, you know, hetero presenting, or, you know, of a certain type of ethnicity within the API umbrella, your experience around safety and violence is going to be different from someone who is queer and trans, who is South Asian, or is Pacific Islander or Native Hawaiian.
Yeah, I think, thank you so much for that example, Sonia, because what you're pointing us to is the idea that even within communities that are seen as homogenous, there is so much, there's so many intersecting identities that actually create really unique experiences for them, even within the community of AAPI queer folks. And also, I appreciate the comment that you made about, you know, in thinking about how we respond to something like hate crimes, right? Very often the push is, you know, anti-hate crime legislation, more laws, more policies, but we know that when we pass more laws, the people that are impacted by these laws are actually queer communities, they're BIPOC communities. It's very often not the people actually committing the hate crimes that are targeted by these laws. So I appreciate the kind of nuance that you're using in thinking about this. So Romel shared that at their workplace, they do equity check-ins, which is ultimately an intersectional check-in, right? What are the biases that we're having with the scenario? So they do it weekly. They, I'm assuming that it's maybe like at a case meeting, at a group work meeting, and they check in about, you know, what are the biases that we're having in relation to X, Y, and Z clients, where they're really kind of unpacking the ways that they are understanding the people that they're working with and how they're understanding their biases may impact the work that they're able to do with these folks. I think that's a really beautiful way to think about accountability, because it's an ongoing method, right? It's an ongoing conversation. It's not one training and that's the end of it. And that's really what we need to be thinking about, is how we build this in an ongoing method, right? It's not just, we're going to talk about it at one point and then we're going to move on and that's the end of it. So I really appreciate this idea of having weekly conversations that check into these things for every single client.
Right. And I just want to say that that's part of, in our work, right? Using cultural humility, which is a lifelong process of like self-reflection, self-critique, and overall examining our beliefs, our culture, our identity. So that is a great example of that there. Anyone else want to share anything that came up? All right, I will just add one more here before we switch on over to the next slide. But I was in a group, and I think I can pronounce her name right, but Janisha shared that she's working with a trans youth or individual, and who came in initially kind of experiencing gender dysphoria. And so one of the approaches that she took in her work, again, looking at all intersections of identity, was like, okay, you're dealing with gender dysphoria, you're identifying as trans, and then taking that mindset and going, okay, what is someone that's trans maybe experiencing? So one of her first couple of questions might have been looking at religion. How did your family grow up? And again, thinking about, could religion be impacting or increasing the gender dysphoria? And then she started asking questions about, how did your family, you know, respond? What's your family's belief systems around these things? Because again, in the work that I do, I can tell you a lot of the folks that I see for gender dysphoria have more acute symptoms of that when the family is unsupportive or they come from an extremely religious household. So that was just such a great example of I met this person and these were two things that initially popped into my head that I need to be looking at and assessing, because again, what this person's experiencing could be coming from sexual orientation and gender identity, but also religion, family, and then maybe even geography. What area are you living in? So that's just kind of another great example there. But we'll switch on over, and I just want to say we're going to continue this conversation on intersectionality as we get through these trainings. We're also going to be providing worksheet handouts, and in the fourth session, we're actually going to be doing an activity together where all of us are going to be kind of analyzing our own layers of privilege and oppression to see how does that impact the work we do with individuals that maybe don't feel represented by us or how we're showing up. So we can go to the next slide.
All right, folks. So really, when we're thinking about intersectionality, part of the reason that it's so important for us to practice through an intersectional lens is because when we don't, as mental health workers and as community members, right, even just as neighbors, we end up causing more harm. And part of what this often looks like for people that are navigating mental illness is criminalization. So let's unpack that a little bit. And really, in order for us to understand criminalization, we have to understand the context that we are currently living through, right? The context of the United States. So we are currently living under what Angela Davis, who is in this image here, she calls this, Angela Davis, another activist abolitionist, they call this the carceral state, right? And I know that sometimes this language can be really off-putting, but let's just stick with me through this. The carceral state refers to a nation state, in our case, the United States, where every social problem like homelessness, drug addiction, mental illness, poverty is dealt with through criminalization, discipline, and incarceration. So the reason that it's so important for me to name and to define the carceral state is because under the carceral state, we deal with every social problem through discipline, right? This means that we over rely on police. We have such huge expectations of police, regardless of what your feelings about police are in general, right? We have really huge expectations of them when they don't have the trainings that they need in order to be able to respond to every single crisis that they get called to. So under a carceral state, it's police and prisons that manage every single social issue, including things like drug addiction and mental health issues. Next slide, please. And so when we apply this understanding of the carceral state as a state that deals with all social issues through incarceration, we understand, right, that for people experiencing mental health issues or a mental health crisis, what we see is that the symptoms of mental health issues like aggression, maybe there's talking to themselves, they become reasons for police intervention, which ultimately puts people experiencing mental health crises, especially if they're poor, especially if they're disabled, if they're queer, if they're people of color, this puts them especially in a position to experience further criminalization. So for example, if a person who because of racialization is already seen as aggressive, as defiant, as dangerous, experiences acute irritability as a result of a mental health issues, the behaviors that are related to that irritability, like fighting or aggressive arguing, often prompt the people around them to call law enforcement, right? And so in this example, the person isn't breaking the law, right? Arguing isn't against the law. Talking loudly is not against the law. But because of the ways that racialization sees these people as already dangerous, already pathologized, law enforcement becomes involved. And because we have no other resources for de-escalating an oncoming crisis, people tend to call the police. And this begins a cycle that is really difficult to get out of, a cycle that you all have seen, I'm sure, a million times in the communities that you work with. And so that's what this graphic is really pointing us to, right? Now, I know that not all of your clients are unhoused, but many are very likely dealing with the ramifications of poverty and are experiencing a lack of basic needs, including things like unstable housing, difficulty finding work that will support their entire family. And so we know that when people are struggling to meet basic needs, mental health crises increase. And these crises can result in behaviors that the general public see as scary, and very often it justifies police intervention. So this means that for poor people of color who are experiencing mental health crises, they're likely going to have more interactions with the police, which can lead to arrests, and this is what the cycle is pointing to, okay? So follow along in the cycle with me, which can lead to arrest, can result in time in jail or in a psychiatric institute, and eventually they're released, right? More traumatized into the same circumstances that triggered the mental health crisis in the first place. But in order for the cycle to continue, there are behaviors that we as community members or as mental health workers, as the general public see as dangerous. And that justifies us calling the police. So let's reflect on this a little bit. What are some symptoms of a mental health crisis that would typically get the police called on somebody? And the question is also on the next slide for folks to read.
Yeah,
Take
so
a
I wanna
moment
ask-
to reflect on this. Sorry.
No, so I want to ask y'all, in your experience or just from what you see, right? What are some mental health related behaviors or symptoms that you have seen law enforcement become the responder to?
Take a minute to reflect on this. You can drop it into the chat or you're also welcome to unmute. We'll give you all a minute to reflect.
I could go. So I worked for 4 years in a group home, and I like seen this a lot as far as police involvement when it comes to adolescent behaviors that were mental health, and it was always when it was anything that has to do with suicidal tendencies or behaviors, or self-harm. Because at that time, I do want to say, like, I'm not too sure for every group home that exists, but I noticed that there wasn't proper training for I and every other individual that was there. And so for me, this was like the first job I had where it was really mental health. So I got to see how, police were literally called for everything, anything from like a little scratch on the arm. It just was blown out of proportion. And so like, I feel like it was often that connection between mental health and police involvement was so strong when I first started out in this career of mental health. So that was one of the things that I remember.
Yeah, absolutely. And I think that when it comes to something like these outward crises, right? Maybe like somebody's enraged, somebody's hurting themselves, trying to hurt somebody else, our immediate thought is to go to the police, right? It's an over reliance on police. And I think that Ali can really speak to this because that was the policy in his clinic when he first started working there. Ali, do you want to speak to that a little bit?
Yeah, that definitely when someone expressed suicidal ideation, the response or the policy there was to, call the crisis team and call law enforcement. Again, no pause of like, maybe we can get this person to safety. Maybe we can agree on a safety plan before we even need to do that. It was just, oh my God, they're expressing this, therefore we need to act on it. And again, in my clinic, so many folks have shared, I do not find being put on a hold helpful. I do not find law enforcement to be responsive. And just thinking about how law enforcement shows up, right? Very often, even if they're not pointing that gun, they have a gun on them. So when someone's experiencing, PTSD or, anything like that, they may find that can actually trigger more of those symptoms. And again, not feel safe. Therefore, we're going to only escalate in whatever we're experiencing.
And I know this conversation can feel really abstract. Throughout this entire cohort series, you will walk away with active tools that you can use to de-escalate an active crisis. And then Luna says, currently working with one client experiencing homelessness and dysphoria crisis. I also have personal lived experience living in Imperial Valley, a rural, conservative, predominantly Hispanic area. There is a lot of intersectionality in our community, and law enforcement is a constant source of trauma and re-traumatization. Homelessness, right? This is, we live in a community, Ali and I, where there is a really big unhoused population just, right next door to us. And the police are called constantly for things that are not crimes, right? Somebody's talking to themselves, somebody is muttering to themselves, and it scares one of the students because we live in a college community. It scares one of the students and the police are involved for something that was not a crisis in the first place at all. It may have felt like a crisis to the student walking by, right? But if that student would have been using an intersectional lens, they would have realized that they could have just walked away. That person wasn't bothering them at all. And then Meg says, Mile Hall's parents had notified the police that their son had mental health issues, but the crisis unit was not able to respond in time when he was having an incident of harm, and he was killed by the police who responded to the call. And we see this so often, right? There was just an incident in Los Angeles. I'm gonna be really quick with this because I know that we're running out of time. It was a big incident. I'm sure many of you all have heard of it, where police responded to a crisis in a department store. There was a man there who was being violent towards women, and he was actively harming, any woman that he could find, he was beating them. So the police responded. The man had a chain, and instead of disarming him, right, they shot him immediately. He didn't have a gun. They didn't kill him. They killed a child who was hiding behind a wall, right behind where he was. And so we see, right, that even if it's not a direct physical harm to the person, police response that results in something like a shooting creates harm for everybody in the community. It's not just for that person. Even when there are ways to de-escalate a situation like that, to maybe disarm somebody like that, you know, in ways that don't require guns or, you know, this brute force. So ultimately, when we're thinking about this conversation, what we want you to walk away with is this understanding that we have an over-reliance on police and we are allowed to dream, right? We have imaginations. You all have tons of experience. And I bet you that you can think of several other ways to de-escalate a crisis without involving the police. And we're hoping, and we will provide resources for how to do that, especially in the next session. All right, thank you all so much for sharing. I appreciate all of the insight you share. Can we go to the next slide, please?
Okay, so this is
me. So in thinking about people like, so for example, right, queer folks, queer communities who are already navigating homophobia, transphobia, and any number of overlapping privileges and oppressions, we can bet that for these folks, the compounding of things like race, sexuality, gender, and all of the other privileges and oppressions that they're navigating create the circumstances where they're incarcerated at higher rates. So in fact, for lesbian, gay, and bisexual people, they are incarcerated at 3 times the rate of straight people. And this overrepresentation is due to a lot of things, right? But it's largely due to the obstacles that LGBTQ people face after maybe fleeing an abusive household, being rejected from parental families and households. And so, right, they end up on the street and they're ultimately pushed into informal economies, right? This means drug sales, sex work, informal economies that are often criminalized. And so there are, for queer folks, there are intersecting reasons that they become incarcerated, criminalized, and contained at higher rates, right? It's not just because they're queer, it's not just because they're trans, but it's because they're queer, trans, and homeless, and maybe of color, and maybe poor, and maybe they're disabled, and maybe they're struggling with mental health issues. So when we're working with folks, it's crucial that we have a robust understanding of the experiences that land them in somewhere like prison. Next slide, please.
Again, continuing to think of that intersectional lens, right? When we look at like BIPOC trans people who have been incarcerated, you can see here through these numbers, if you're trans and white, the chance that you'll be incarcerated right here, 12%. And I mean, what stands out to me, right, is this big number here, 47% of trans folks that are incarcerated are Black. So we can see here that, again, all these folks identify as trans, but when we add the layer or the identity of race, skin color, we see here the disparity skyrocket. So we just wanted to share these with you to kind of highlight that, like, not every trans person is going to have the same experience. It's going to change based on race, right? And so I look at this number and this makes sense to me. I work here in Santa Barbara and it's largely a white and Hispanic population. So I had one kid come in real quick and he was just like, telling me how he was using drugs. He's a white trans man, has a lot of money, but he was on the street with his friend and they were doing shrooms. They were, roaming the streets and disrupting traffic, and someone pulled over and said, "I'm going to call the cops on you." They were high, so they laughed. Cops were called. And when the cops got there, the response was, "Where do you live?" "Oh, Montecito," which is a wealthy neighborhood. "Okay, we're going to call your parents to come and pick you up," even though law enforcement knew they were on shrooms. Again, where I think of like that experience as this person shared this with me, and I'm going, wow, if this had been a brown person, a Black person on the street under the influence of shrooms, disrupting traffic, finding law enforcement comical and hilarious, they would have been, without a doubt, put on probation or given some consequence. So we can just kind of see here through this example that, race can impact the chances of one being incarcerated. And then we'll go to,
yeah,
go
next
ahead, Bella.
And so when we keep our intersectional lens on, and when we look at these stats, we understand that queer BIPOC people are experiencing incarceration at higher rates than the general population. And when we couple that with mental health crises, we can guarantee that these numbers are going to be even higher. Ultimately, what this tells us is that when the intersections of racialization, sexuality, gender, and mental health come together, the likelihood of criminalization is exponentially higher. And in that resource list, in the link tree that we shared with you, there's a facilitators, it's titled Facilitators Guide. This has more information on understanding intersectionality that you are welcome to review. It will help you really gain an understanding of what this looks like in mental health work. And another one of the resources that we'll go over at one of the future trainings, it's a self-reflective intersectionality exercise. So part of doing good crisis work means being aware of ourselves, right? What are we bringing into the space? I know that it's really difficult sometimes for people to talk about countertransference and to see the ways that, you know, what we're bringing into the space really impacts the outcomes for the people that we're working with. These are great opportunities, the worksheet that we're going to share, for you all to practice self-reflexivity, and to, if you're struggling with colleagues who aren't great at this, this is a way that you can get them to start thinking about it. So if you look on the link tree, you'll find those resources. Next slide, please.
All right, so this kind of where we'll wrap up here, but again, these conversations will be ongoing, kind of prepping you all for the third session here. Understanding how to practice crisis care through an intersectional lens is foundation for creating equitable circumstances in marginalized communities accessing crisis care, and allow us to be able to make empowered non-carceral decisions when dealing with crisis. Again, we'll continue this conversation, but overall, we're going to focus on the brain's functioning during crisis, the neuropsychology of crisis, and tools that can help us de-escalate active crisis situations. And just want to repeat, Bella, for you all to take a look at the resource facilitator guide that we have on intersectionality, because it breaks down privilege, oppression, and it can give you an understanding of different layers of identity and what barriers they may be facing.
Yeah, and you're welcome to review that, you know, now if it's helpful for you. We'll be doing it together at a future session, but if it's something that you need now, please, by all means, feel free to check it out. These are our emails. Please feel free to take them down in case you do have any questions or want to follow up on anything.
Thank you so much, Bella and Ali. What an excellent presentation today. Thank you to all for the significant work that you're doing out in the community, that you're taking time to attend these sessions, and that you're showing up and participating. It is to the benefit of the community that you are willing to show up and engage in really intense content. Have a great day, and we'll look forward to seeing you at the next event.